Hi, I'm Mandy Cotton, family nurse practitioner, and today I'm going to discuss how to do a consultation with a male patient. Hi, how are you doing today?
Very well, thank you.
Good. How'd you hear about us?
A friend of mine had been taking pellets for some time. He keeps talking about it, seeing as how I've lost a lot of energy, and especially at the end of the day, I decided to come in and chat about it.
Well, wonderful. I'm so glad you're here. We did get your lab results in that you had drawn prior to today's consultation. So if it's okay with you, I'm going to go through those labs with you,
Sure.
kind of give you my recommendation, and then you can ask me whatever questions you have at all.
Okay.
Okay, so your testosterone level was a 333. We really want it to be 800 to 1100, so it's pretty low.
Very low.
The reason that we want testosterone to be 800 to 1100 is because of this chart right here. This is based on some studies that showed that most men around where you're at, 300, are going to be pretty symptomatic. I find that most of my male patients, when they refer to low testosterone symptoms, are something like you're saying, low fatigue, especially in the afternoons, maybe feeling like they need to take more naps when they get home from work, or falling asleep while dinner's being made, having less motivation, less stamina, sometimes erectile dysfunction, sometimes not, and sometimes just decreased quality of erection. So maybe not able to maintain an erection, or maybe climax is a little bit different than it used to be prior to. A lot of patients will say, why 800 to 1100? And a lot of it is based on this. So men that have testosterone less than 600 have an increase in all-cause mortality. Men that have testosterone levels lower than about 800 or 840 have an increased risk for prostate cancer, increased risk for diabetes. And then higher than that, 900 and plus, is really where we get brain protection. So the bigger picture is, I know you didn't come here and say, how can you protect me? But the bigger picture is that hormones can be protective in the body. So while we're trying to alleviate symptoms that you're having, fatigue, decreased stamina, decreased motivation, sometimes brain fog, joint pain, not sleeping quite as well at night, the bigger picture is that hormones can be protective to your bones, your brain, your heart, those kind of things. Does that make sense?
Okay.
Okay. So we do get a PSA, which is an indicator of prostate health. Yours was at a 0.6, which is great. We want that less than a 2.5. Okay?
Okay.
We also got a vitamin D level on you. Yours was at a 32. We really want that to be greater than 40. Vitamin D is very important for your bones and your heart and cancer prevention, so we definitely want to get that level up a little bit. Plus, it's going to impact your energy in a beneficial way.
Okay.
Okay? Mm-hmm. Your thyroid is kind of borderline low. Your free T3 is at a 3.0. We really want it to be 3.5 to 4.3. So low thyroid contributes to fatigue as well as belly fat weight gain, cold fingers and toes, dry skin, thinning of hair, sometimes constipation as well. Are you having any of those symptoms? Thinning of hair. So with it being at a 3.0, we could start you on an iodine supplement, or with the thinning of hair, we may recommend a low dose on the thyroid medication. We use a natural thyroid medication called desiccated thyroid. The reason that we use that over some of the synthetic preparations is that it has both thyroid hormones in it, so both T3 and T4 in one pill. So we'll go ahead and start you on that. And then the testosterone will be in the pellet form. That will get injected into the fat tissue on the hip. It gets absorbed over a period of about 4 to 6 months, and then you come back for reinsertion. We always check labs 4 weeks after we get your pellets and start you on the new medication to make sure that we get your levels into the optimal range, so that 800, 900 to 1100 range. And we do that to make sure that you're getting therapeutic and feeling the best that you can feel. Okay. Most of my male patients come back for reinsertion between 4 and 6 months. So I'd like to go ahead today, if you want to get your pellets, we can do that. Let me talk to you a little bit about the procedure.
Are there any side effects?
So typically in males, the main side effect that I see is about 10 to 15% testicular shrinkage. That is one of the only side effects that I see in male patients. Occasionally, you'll see some male patients will convert testosterone into estrogen. All men have estrogen, and you need some estrogen at healthy levels. But if that level converts at a higher rate, which it does in some people, you can get some unwanted side effects. Nipple sensitivity, sometimes some breast enlargement, as well as feeling overly emotional. So that is one of the things that we check on those follow-up labs. One of the other side effects you can see is an increase in your hemoglobin and hematocrit, which is something that we also will check on those 4-week labs to kind of see where your levels are at. In order to kind of front run that and kind of prevent the estrogen levels from rising, we put you on a supplement called DIM. So DIM does a couple different things in the body. It helps you maintain a healthy balance between testosterone and free testosterone. You want to have more freely circulating testosterone in the system because that's where people get kind of the feel-good effects of the testosterone. So more energy and more libido.
I take a number of heart medication pills every day. What kind of interaction might there be between them and the pellets?
So there's not going to be any interaction. We are going to monitor your blood levels to make sure that your hemoglobin and hematocrit remain in a normal range, but otherwise you shouldn't have any impact. And testosterone is actually beneficial to the heart and going to help decrease inflammation in the heart. So you're actually going to see some benefits from this as well.
What about my antidepressant that I take?
So I have a lot of patients that come in that are taking antidepressants. I always encourage them to continue through this first round of pellets because I want to get you optimal before I start removing other things kind of from your regimen. So what I would recommend is continuing the antidepressant through this first round, and then when we follow up in 4 to 5 months from now, we can kind of talk about how you're feeling. And if you're feeling a lot better mood-wise, we can definitely talk about how to wean off of that medication.
Okay. My son is just 34 and recently got married, and he's having a number of the same symptoms that I am. What would you recommend for him?
Well, he would definitely be a candidate to have his labs drawn. I think looking at his testosterone and thyroid levels would be a really good idea. However, we do recommend not getting on pellet therapy if he's actually trying to conceive right now. So if he and his new wife are wanting to have a baby, we recommend kind of holding off on the replacement therapy for now until after that. That is because testosterone from an external source, like pellets, will decrease his sperm count, and it takes about 8 months for that to return. So especially with him having a new bride, that would be a conversation I would definitely get him to have with her prior to coming in for a consultation. So do you have any questions, or would you like to do your pellets today while you're here?
Well, it all sounds very good. Very good. What's involved with the procedure? And
sure.
Can I go ahead?
Of course. We can definitely do your pellets while you're here today. Let me talk to you a little bit about what the procedure entails. Okay. So what I do is I numb up a small area on the hip with some local anesthesia. I make a small incision, and then I put the pellets into the fat tissue on the hip. I seal that up with a steri strip, and then I put a bandage on top of that. The bandage stays in place for 7 days, so we ask that you kind of refrain from some activities. So no hot tubs, bathtubs, swimming pools, or gluteal exercises for 7 days. And that's just to allow the area to heal, so that way you don't have any issues with infection or the pellets coming back out of the incision. After the procedure, we always do labs 4 weeks later, and that's again to make sure that your levels get into the optimal range. So what I'll do is I'll go ahead and send your thyroid prescription over to your pharmacy, and then we're going to put you on a vitamin D supplement as well as the DIM. Iodine is another supplement that would be really great to help support your thyroid health. All of these supplements you can get here in the office today if you'd like.
Very good. Well, let's go ahead.
Okay. This concludes the patient consultation with a male patient.